In late 2011, there was a publication from the Institute of Medicine called Clinical Preventive Services for Women, Closing the Gap. And that publication came about because as part of the Affordable Care Act, the legislative language specifically called out the issue of trying to identify those areas in women's health for which there should be coverage with first dollar coverage, that is, without having to pay a copay. And the reason that women's health was called out was because even though we had lots of information about what was evidence-based practice in that area, a lot of that evidence hadn't made it to the U.S. Preventive Services Task Force, to a lot of the other kind of official bodies that provide recommendations. And so when Congress sort of created this legislation, they wanted to kind of level the playing field and make sure that women's services were accounted for. And a group of us, 11 of us from across the country, I was privileged to be part of that group, were brought together to assess evidence during a relatively short period of time and develop a short but comprehensive list of recommendations of what needed to be covered. Like I said, the ACA essentially requires that group health plans provide benefits for and prohibit the imposition of cost-sharing requirements with respect to certain classes of items. Anything that shows up on something called the U.S. Preventive Services Task Force recommendations. Has anybody heard about the U.S. Preventive Services Task Force recommendations? Raise your hand. So maybe like less than 10% of the room. The U.S. Preventive Services Task Force is a quasi-governmental committee out of the Agency for Healthcare Research and Quality. This entity is designated the task of objectively reviewing scientific evidence and making recommendations about what is supported by what kinds of practices among individuals can be supported from that evidence review. I was recently appointed to it. It's a lot of work, but essentially what it does is it really tries to cull through all of the science stuff, which is really interesting and really kind of deep, but not very practical from a clinical standpoint, and certainly not very practical from a consumer standpoint, right? You want to know what applies to you. You don't want to know what was published in the New England Journal of Medicine. So that's what so anything that the USPTF gives a recommendation rating of A or B is going to be a covered benefit under the ACA. So that's a given. So the other thing that is kind of a given coverage item is any immunization recommendation that is made by the American Committee on Immunization Practices. ACIP is a committee of the Centers for Disease Control, and they are the ones that actually set the immunization schedule. Really important for me as the health department director, really important for you as a consumer. Anything that is recommended by the CDC as a recommended vaccination that is age appropriate is actually covered. That means you don't have to pay a deductible, you could just get that benefit. Number 3, with respect to infants, children, and adolescents, evidence-informed preventive care and screenings, as described in a document called Bright Futures, which is a document put together by the American Academy of Pediatrics. So that's a bunch of children's stuff that has to do with keeping kids well. And it documents it by age, and it says these are the kinds of things that are essential for all kids to get in order to be healthy. So with respect to women, evidence-based information, informed preventive care services and screenings, not otherwise addressed by current recommendations, was the task that we were given to embrace. So we had to set some ground rules, and the ground rules was that we were going to make a zillion recommendations. We wanted to make recommendations about where the condition to be prevented affected a broad range of women and girls, where the condition to be prevented had a large potential to impact the health and well-being of our population, where there was good strength and quality of evidence to support that recommendation. And throughout the study process, we repeatedly questioned why this would be offered specifically to women and not men. The second part is kind of important because a lot of people, I'm a gynecologist by training, a lot of people push back on me and say, Francisco, but what about guys? What about men? What about boys? Well, the truth is that the recommendations, the ACA relevant recommendations in the area of preventive services are actually covered under the U.S. Preventive Services Task Force A and B recommendations. That's where men are covered. Were boys covered? Were other children covered? Well, in the Bright Futures recommendation. So men and boys in general were already thought about within the ACA. What hadn't been thought about was women's reproductive health. And that's what we were charged to do. The committee ended up making only 8 recommendations. There were only 8 things that we said that weren't otherwise covered under the U.S. Preventive Services Task Force recommendations that we thought needed to be articulated separately for coverage for women and girls. The first one had to do with screening for gestational diabetes. Even though this was a widely practiced kind of thing, even though this was a widely practiced this was a widely spread clinical practice, it was not something that was actually a recommendation and was not necessarily a covered benefit for all. The second was the inclusion of high-risk HPV testing as part of the cervical cancer screening process. The third one had to do with annual counseling on sexually transmitted infections and the testing that went along with that counseling. Counseling and screening for HIV infection. Also, we were the first actual group to recommend that. And in providing the full range of FDA-approved contraceptive methods, sterilization procedures, and the patient education and counseling that goes along with that. The final 3 recommendations had to do with making sure that there was comprehensive lactation support and counseling, as well as the cost of renting breastfeeding equipment. It's easy to tell people that you must breastfeed, but if we don't create environments that are propitious for it, that really support those behaviors, how do you actually get that to happen? It's kind of a hassle. Screening and counseling for interpersonal and domestic violence was also something that we asked for, that was re-recommended. And finally, the provision of at least one well-woman preventive care visit annually. All 8 of the IOM recommendations have been subsequently adopted by the Secretary of Health and Human Services. New private health plans have to cover these guidelines. Actually should have started in 2012. Of course, there are exemptions for religious employers for the issue of contraception. It's important for us to think about this in terms of Pima County. It has to do with the priorities that we will embark in the next 5 to 10 years. We very purposefully, and one of my bosses in the back row, have decided as a county not to be in the business of providing care to folks. We want to be in the business of getting them to the right care providers, but we're actually just a very small segment of the group of folks who actually deliver clinical services. We believe that part of our role as Pima County is to facilitate people's understanding of the Affordable Care Act, to facilitate employers, medium and small size employers, understanding of how to access that care, of what their role is in that care, of helping individuals understand how to access those kinds of services. And we've articulated that as part of our community health improvement plan. It is actually one of the 4 different themes that we've decided to pursue over the next 5 to 10 years.
So a little bit about the Affordable Care Act and community health centers. We are at ground zero in terms of the care of those that are uninsured, and that is recognized in the legislation with major funding proposed to support community health centers across the country. There are about 1,200 health centers across the U.S. We are one of those, and there are 16 of them in Arizona. So there's $11 billion. I'd love to say that it was all for Arizona, but it's not. It's available over a 5-year period, assuming Congress doesn't do something different with that. And it's targeted for a couple of things at health centers. One is to help us with ongoing operations, to help us identify new locations, new access points where we can serve the medically underserved, and also allows us to expand services at existing health centers. The second part of that is really important in terms of helping us build the infrastructure to be able to take care of people. And in El Rio, we've already benefited from this, from the law. We just received last year $5 million to help us rebuild our Congress campus, which is our original El Rio campus. and also to do some renovation at our pediatric facility down on the southwest side. Provides National Health Service Corps funding to add 15,000 primary care providers across the country. You've all heard about the shortage of primary care providers. It's really going to be a crisis for us as we continue to take care of more people and find ourselves without the staff to meet that growing demand. So there are dollars available for that and for loan repayment programs, which are really, really important for providers who work in health centers. Also looking, trying to take the long view and trying to encourage providers to enter primary care. The law allows for teaching health centers to be developed. So those are sites across the country where family practice residents can come and train and really get that community experience and hopefully grow to love community health. And even if they don't stay at the health center where they're training, hopefully they'll do that work somewhere in the country. The most important that I'm going to talk about in the next 5 minutes, I promise I'll keep it brief, is outreach and enrollment. How are we going to get the word out? How are we going to let people know that this is a great opportunity for them not only to get primary care, but to be able to access specialty care if they need it, or hospital care, etc. So as Congressman Grijalva mentioned, HRSA just announced $2.2 million that will come to health centers in this state to help us get the word out. And so we're going to work in partnership with other organizations to try and get that work done. About $600,000 of that will come into Pima County. And then there's a statewide navigation grant opportunity that will bring $1.5 million to Arizona. So there's a continuum here of coverage. Folks will be eligible either for the Medicaid program. Hopefully, if the governor can convince the House to pass the budget, then we will be able to fully implement the Affordable Care Act in the state. Some folks will not be eligible, but they will be eligible for marketplace coverage. And they need to be able to understand that and understand what their choices and options are. So this is kind of a busy little slide, but we're now trying to work through what the different roles are going to be of the people who are going to be involved in working with consumers and families to tell them what's available and possible. In Arizona, we have a great product called Healthy Arizona that's the front end to the Medicaid system. It's actually been upgraded and it's streamlined, it's very user-friendly. The state is going to launch it any day now. It's going to be very helpful on the Medicaid side. But the interface of that to the federal piece is not yet totally clear, although Arizona intends to work hard to make it as seamless as possible for consumers. So we have a group of organizations and users of Healthy Arizona who are troops on the ground. So Navigators, this is the federal term. What can they do? They can facilitate consumer enrollment in a qualified health plan in the marketplace. They have to be fair, they have to be impartial, they have to provide accurate information. They cannot work for an insurance company or have any relationship to a possible insurer, so that's critical. And they need to be able to support the consumer who's looking at their options and making those decisions. An alliance of organizations across the state that are putting together a proposal for the Navigator program. And it's led by the Alliance of Community Health Centers, but it involves coalitions all over the state. Nuestra Salud here in southern Arizona, Helping Families in Need, the Kids Health Link program out of Phoenix, PCAP, Children's Action Alliance. Many, many other organizations are participating in this grant proposal. And the idea is to take that 1.5 million, which is, again, not very much, but to train lead navigators in regions of the state who can then go out and train other folks on how to get consumers into the healthcare system as quickly as possible. So we're going to use regional and local coalitions. I'm making an assumption that the grant will be funded. I don't know, hopefully it will be. We will rely on a national media campaign to do some of this. There's an organization called Enroll America that's going to start rolling out some national advertising, very targeted advertising, to get the word out on the street about the benefits of the Affordable Care Act. There will be training, web-based training for navigators and for assisters, and as I mentioned, conflict of interest rules. The two goals are, one, to educate folks, and second, to assist those who need assistance. We're going to be doing in-reach and outreach. In-reach, so the El Rio example, we have 21,000 patients that we know may be eligible for full healthcare coverage. So that's in-reach. We have to have strategies to go out and find our patients and talk to them about the Affordable Care Act and get them enrolled if they would qualify. Outreach is going to the general community and talking to Latino groups. I mean, very disproportionate Hispanic population in the uninsured ranks. So very important to reach out to that group. Important to reach out to women's groups because women are influencers. They make healthcare decisions. They influence the decisions of others in their family, and that's going to be critical because we want to make sure young adults enroll if they're able to or if they qualify. So that's that sort of the outreach piece. The time frame is short. I think someone mentioned October. We don't have all the answers. All the federal stuff is not up yet, but I know we can do it, and I think it's just remarkable